I'm Dr. Phil Kieran.
And I'm Dr. Pixie McKenna. What can we do?
We'll be travelling around the country with our pop-up clinic and seeing patients with all sorts of health worries.
As far as
it goes.
Yeah.
Plus, we'll be bringing you advice on the latest medical developments,
Talk to me about bioidentical HRT.
so you know what you need to know to stay healthy.
This week, double trouble for Pixie.
That's kind of like superpower healing. You can keep the toe. Fine, all right?
The doctors do the rounds in Athboy and find out how doctor-friendly the blue jean country queens are.
Would you be put off if you only had a male doctor in your town?
I put off anyway, Jeannie man.
Yeah, I'd put off so.
And Phil meets the Cork scientists who are carrying out world-leading research into the secrets of our gut. The pop-up clinic has arrived at Currickmore House for the Waterford Country Fair. First to see Pixie is 29-year-old Stephen Breen, whose health struggles started when he stopped smoking.
Now then, what can I do for you?
I have a consistent problem with mouth ulcers. I gave up smoking in August. I was smoking 20 a day, and ever since then I've consistently mouth ulcers in my mouth.
And how long would they last for, Stephen?
Depends on the size, roughly. The big ones could last for a week or more.
Okay.
Small ones, maybe 2 or 3 days.
Are they painful?
Very painful. They'd be that sore like I couldn't eat.
Have you had any ulcers anywhere else or any stomach symptoms?
I kind of have a bit of acid reflux as well.
What was the sort of time difference between giving up smoking and this happening?
A week and a half maybe.
And were you ever someone that got mouth ulcers
No,
before?
maybe once in a blue moon basically, yeah.
So ironically, when you were less healthy, you were healthier.
I was healthier, exactly, yeah.
Engineer Stephen lives in Rosslare and is a volunteer with the local lifeboat rescue crew. Stephen splits his time between his work, his young family, and being on standby for a rescue operation.
So I'm crew down Rosslare Harbour Lifeboat. There's 7 people on a shout when we go out at sea. Every Friday night we have exercise for 1 hour to go through scenarios which could happen us at sea. And my health concerns wouldn't really affect me on this, at the moment I'm able to manage it and manage the 2 things at the same time, it hasn't stopped me yet anyway.
Since giving up cigarettes last year, Stephen has struggled with painful mouth ulcers and acid reflux.
Ulcers on my tongue are probably the worst. Stopped me from eating, drinking. It's consistently in pain with them, Yeah, I've lost 2.5 stone since August as well, since I got the fags. The weight was just falling off me, I've changed my diet. I even cut alcohol for a while, but still persisted, it did. Kind of a roller coaster. I give up one thing and I have more problems then in the long run, It'd make you want to go back on the cigarettes now at this stage,
Have you been prescribed anything? You've been to the doctor, the dentist?
I've been to the doctors, I've been prescribed steroids, I've tried gels, creams, everything that's available.
Right.
And there's still
No joy.
No joy.
Well, look, let's have a look at the ulcers. If you want to pop over here with me, okay? Just through here. And if you want to get yourself up on the couch there. Brilliant. Let's have a little look then. I'm going to pull this right back if you don't mind. Okay, so that's a pretty classic one. And then you've got there was one there. Wow, right.
Smoking shuts down the blood vessels in your mouth. Over time, there's less blood supply to your gums. When you stop smoking, ulcers can appear in the first 2 weeks, a sign that the blood supply to the lining of your mouth is improving.
I mean, how do you eat?
It's patience. My tonsil, the bit that sticks down, I had one on that.
Oh, right.
And I couldn't even swallow with that. The pain was unreal.
The link with stopping smoking is interesting because we do see ulcers in patients who have gut diseases, so they have things like inflammatory bowel disease. And in certain patients, they know that if they smoke, their condition becomes a lot less. Your weight loss concerns me slightly. I do think that maybe part of that might be tied up in this whole thing as well, so I think that needs to be explored. Having a management plan in terms of treating them is obviously important, but I think a full gastro review, really looking from your mouth right down, is important. You're out there in the high seas saving lives, so the least we can do is hopefully put an end to this for you.
Hopefully so, yeah.
But yeah, please don't start smoking. You've come this far, don't start again.
I'll try that anyway.
With symptoms of consistent mouth ulcers and acid reflux, combined with Stephen's weight loss, Pixie is keen to have him tested for a potentially serious underlying illness. The annual Blue Jean Country Queen Festival sees young women from across the country compete for the coveted title. But which country queen will come out on top when it comes to the topic of their own health?
Looking after your body and checking yourself regularly is one of the most important things you can do for your health. A simple 5-minute check could save your life.
Breast cancer is the most common malignant tumour in Irish women. So knowing what to look out for is vital. Anyone here do breast self-examination? No? It wouldn't be unusual for your age group not to do any checks. Ladies, we've only brought one.
So we'll have to share.
Yes. So, does anyone know how you might check? To try this.
I definitely can feel something, but I'm probably checking wrong. Do you reckon, do we?
Just grab it. Now, you show us. No, you were saying.
Push it up around the nipple and around in circular motions.
Yeah, you're right. You're absolutely right. You kind of use.
There is a lump. There's 2 lumps there, is there?
But remember, if you were doing it on yourself, you kind of paddle round the breast. So you're going to use your palm of your hand, but also the tips of your fingers. And you're absolutely right. You circle, you start on the outside and you go
Work your way in.
Right, the way in. Because women of your age can get lumps in the breast.
Can it start like underneath your armpit if it is for your breast?
Yes, it can, and that's a very good point. It can start under your armpit, so there could be nothing in your breast. It can start under your armpit. Or the first sign may be something like your nipple turning inwards, or puckering of the skin, or even skin changes like eczema and stuff on the surface. You know, look. So look in the mirror, have a look externally, listen to your body and feel round. Would you be put off going to the doctor? Like, say, maybe you have to go and see someone like Phil, if you only had a male doctor in your town or something.
Well, you put it off. You definitely I put it off anyway, Jeannie, man.
Yeah, I'd put it off, so. Yeah,
Keep it back in my mind.
You're the new generation.
I don't know, I just feel uncomfortable.
A lot of the times when people do come in with a lump in the breast, quite frequently it's something fairly straightforward and you can be reassured very easily. So it's something that you shouldn't be put off or shouldn't be embarrassed about getting checked out. It's important to do it.
Yeah, true. That is very true.
It seems every day there's a new story about the gut and how it affects our health in new and surprising ways. It influences our weight, our mood, and even our immune system. So is gut health the key to good health?
Bad gut health symptoms include bloating, diarrhoea, constipation, and irritable bowel syndrome. Gut problems are also being linked to skin conditions, weight problems, autoimmune diseases, and even mental health. The latest research is revealing that if our gut is not healthy, then neither are we.
Let's try and imagine what's going on in our gut. This bowl is your gut, and these different colour sweets represent different types of bacteria living in there. Each of these bacteria has a different job to do. Let's imagine, for example, the purple ones break down fibres, the yellows make certain hormones, and the orange ones, for example, make vitamin K. Now, what happens when we start having an unhealthy diet? Well, if we get rid of fibre in our diet, all of a sudden these purple ones have nothing to feed off, so we lose them. And then something else happens in our life, like we take a strong antibiotic. It doesn't just target the bad things that are happening in your body, it targets all bacteria. So it wipes out everything except for one type of bacteria which is immune to that antibiotic. In this case, let's say the red sweets. What we're left with is just one type of bacteria, and the problem there is that they can repopulate, and that's going to make you feel very sick.
But can we change our gut bacteria for the better? Leading research is taking place at Teagasc Food Research Centre, where they're developing groundbreaking new ways to treat illnesses using gut medicines.
Tell me a little bit about what's going on here.
This is kefir. It's a complex of different microbes all together, and you put it into milk and you ferment the milk.
Right.
And all of the good microbes that are in it enter into the milk, and then we drink it and it can get into our gut.
Traditional kefir milk is made from kefir grains and whole cow's milk. It's a natural probiotic. Probiotics are living organisms and are good bacteria. They're found naturally in some yogurts, kimchi, sauerkraut and miso.
So these are all different bacteria, and in fact some good fungi as well that we've gotten from the kefir. And so we're studying each of those individually to see which are the best of them. And so in theory what you could do is take them all, put them back together and get an even better version of kefir that's optimized in terms of our health benefits.
Say I have a specific illness, you may be able to come up with a tailored probiotic just for me.
That may be the case. Now, it may not be a particular type of fermented milk. It may again be a gut microbe, but we have a better sense now of what the good guys and what the bad guys are in our gut. And so by growing them and harnessing them properly, then there is the potential to treat your particular scenario. Eventually, I think there will be a full array of different probiotics and different microbial treatments to impact on a broad number of different syndromes and diseases.
Tailored probiotics may be a little way off. In the meantime, the simple ways to improve gut health are: avoid unnecessary antibiotics, eat more fibre, avoid processed foods, try fermented foods like sauerkraut or live yogurts, and exercise to get your gut moving. Dr. Pixie McKenna and Dr. Phil Kieran have been travelling the country in their pop-up clinic, meeting patients with all sorts of health worries. Earlier, Stephen Breen came to the clinic with persistent mouth ulcers, which developed when he quit smoking. Added symptoms of acid reflux and weight loss meant Pixie has sent him to gastroenterologist Dr. Conor O'Brien, who sent him for a stomach ultrasound. Stephen has also discovered a family history of celiac disease.
Now, I'll have a look at all those pictures and I'll do a report for Dr. O'Brien.
Now, mouth ulcers can obviously just be purely due to a local problem in the mouth, but they can also be associated with systemic or other problems throughout the body, okay? And obviously I'm a gastroenterologist, so we focus on the gastroenterological problems that can be associated with this. Now, one of them is celiac disease, which you probably know a bit about. Your grandfather has it.
Celiac disease is a digestive disorder caused by a reaction to gluten found in wheat, barley and rye. Undiagnosed, it can cause serious complications, including osteoporosis, neurological problems and some cancers, including bowel cancer.
So usually what we would do in this situation is, particularly given your history of the reflux as well, we would offer you a gastroscopy. That's a camera test where we look into the tummy. We can also take samples to definitively check if you've got celiac disease. And we can also check you for Helicobacter, a bacteria in the stomach that can also be associated with mouth ulcers. We'd also usually do a camera test to look into the colon to see if there's any evidence of inflammation there that will be suggestive of inflammatory bowel disease. Okay?
Because of his family history with celiac disease, Dr. Conor O'Brien has booked Stephen in for an extensive examination to test for celiac disease or an inflammatory bowel disease like Crohn's.
The first thing we're going to do is your gastroscopy, and we'll give you some sedation, make you nice and relaxed, pass the tube in, goes in through the mouth, goes down where the food goes every day, okay? And then after that, we'll do the colonoscopy procedure.
The camera moves down Stephen's throat and into the stomach. Once inside the stomach, air is blown to allow the doctor to see any unusual redness, holes, lumps, blockages or other abnormalities. If abnormalities are detected, a tissue sample will be removed and sent to the laboratory for closer examination. Next, Stephen has a colonoscopy to look at the lining of the large bowel. This test is used to detect health conditions like inflammatory bowel diseases and bowel cancer.
So, said Stephen, we're on our way out now.
Dr. O'Brien and his team have completed all the tests and will send bloods to the lab for analysis. Stephen awaits his results. Over at the Irish Maritime Festival, 64-year-old Margaret Hughes has come to the clinic to see Pixie about a very common and very uncomfortable problem.
Right, so we're going to take a little look, all right? Are you all right there?
Yes.
Okay, so look, what you've got is you've got a couple of little tags of skin from where you would have had old hemorrhoids, which is quite common. But they can be a bit annoying when you're trying to wipe your bottom and stuff. But the main problem is this guy, which is a little hemorrhoid, which is coming from the inside, but poking down outside, okay? So it's what we call, it's prolapsed. Normally they hide inside up your tail end, but this one's coming out to say hello. And the problem with those is because they're outside, when they used to live inside, they can get irritated by all kinds of things. But you know, personally, while the creams and things will make a little bit of a difference, it needs a bit more further action if it's bothering you at this stage. While there is the option of going in and cutting out hemorrhoids, that could be managed by either what we call ligation, which is literally strangling it. You put something around it, you kill the blood supply, it dies and it falls off.
or sclerotherapy, which is where you squirt something into it and you almost poison it so it shrinks up. Occasionally heat therapy is also used. So there are a few options which aren't massively invasive surgical procedures. These things aren't cancerous, they aren't pre-cancerous or anything like that. They're just really annoying. And that one's come out to say hello, and it's unlikely to go back in again. Hemorrhoids, also known as piles, are essentially varicose veins of the tail end. They are incredibly common, but not very often talked about because people are embarrassed by them. Usually they're managed pretty easily by going to your pharmacy or getting a prescription from your doctor, but occasionally they need more intervention, whether that's a local procedure or a procedure done under general anaesthetic.
Pixie has advised Margaret to go back to her doctor for a procedure to get rid of the painful hemorrhoids once and for all. Earlier, Phil found out how improved gut health can improve our physical health, but can it improve our mental health? At the APC Microbiome Institute in University College Cork, scientists have made an amazing breakthrough. Phil meets Professor Ted Denan, a psychiatrist involved in this incredible discovery.
The gut microbiome is more complex really as a system than we are. When people say they have a gut feeling or butterflies in their tummy, is this a concrete connection then between the gut-mind connection?
Well, it absolutely is. There are routes of communication that communicate that signal to the brain. The vagus nerve, which sends signals from the brain down to the gut, likewise sends signals from the gut up to the brain.
And that's this yellow thread that we can see goes everywhere, doesn't it?
Absolutely. And it's innervating organs in the chest, like the heart and the lungs.
I wonder, do you think it's possible that in the future we may be looking at tailored probiotic treatments to try and treat conditions such as depression or anxiety or other conditions like that?
I think we will, even in something like depression. I mean, we've shown here that in depressive illness, there is a narrowing in the diversity of the microbiota. So it may very well be in the future that increasing that diversity, we will see a probiotic or a combination of probiotics, which I call a psychobiotic, for treating depression. And that's likely within a relatively short period of time.
It may be that instead of being prescribed antidepressants, you'll be advised to consume bacteria. The findings need further study, but it looks like the secret to our own happiness may lie in our gut microbiome. Enjoying the Waterford Country Fair are battling brothers Richard and Thomas Murphy, who've come to see Pixie with their mum Joanna.
You're all ready to show me already.
When I was in Spain, I was getting out of a car and I tripped and I went right into a cactus thorn, and then...
You got this?
Yeah, I got this, and then every time I had a hot bath, the next day it went black and it was lumpy.
When were you in Spain? How long ago was it?
2 or 3 years ago.
Okay, all right.
I don't really want this.
You don't want it there?
No.
Okay. Do you mind if I just put a finger on it?
I think we got all the 3 thorns out.
Yeah. I'd say what happened was you got it all out, and now what you're left with is, that's kind of like super healing, like superpower healing. So a thing we call a dermatofibroma, right? That's a very big word, but it's quite a common thing to get on your legs or your arms, particularly after you've had a thorn or a bite or something. Don't poke it or prod it or try to squeeze anything out of it. Just leave it alone, right? It's totally fine to ignore it. Okay?
Yeah.
And it'll get paler and paler.
Okay.
But it's kind of like you've got super healing powers in there.
Okay.
Okay? Now, what about you?
My toe.
It's very thick, isn't it, your nail?
Yes.
Yeah. Do you cut those nails yourself, or does your mum help you?
Sometimes she cuts it and sometimes my dad, and then sometimes I cut it.
Yeah. That little bit of nail, it would be worth getting some pieces of that nail and sending it off just to check that you haven't got anything like a fungus in there.
The whole nail?
Yeah, just a little.
Just a little tiny piece of it. You can keep the toe. Fine, all right? Do you play a lot of sport?
Football, hurling, riding, rugby, a few other sports, and soccer.
Yeah. It may be that what's contributing to this is the fact that you're playing a lot of sport and your nails have been bashed up against the top of your shoes, and lift it off the nail bed.
But in soccer, you do toe banger when you use your toes to hit it.
You do toe bangers, right. Now, the other thing to say is that the nails should be clipped with the nail clippers.
Yes.
And he shouldn't be doing it himself, because with this, you can see this toenail here, look, is going in. It would be a bit annoying to get an ingrown toenail and then get little infections and stuff in it. So just be careful with that. Clip them straight across. A clippers is best. It's easier actually anyway. And getting someone else to do it for you. Okay, pamper yourself. Right?
Okay.
Well, what to say?
Thank you.
No, thank you.
Thank you very much.
29-year-old Stephen Breen came to the clinic with chronic mouth ulcers, acid reflux and weight loss. Pixie has referred Stephen to see gastroenterologist Dr. Conor O'Brien for a thorough examination because of his worrying symptoms and family history of celiac disease. Today, Stephen hears the results.
We had a look into your tummy, and that looks at your esophagus and your stomach. We took samples of your small bowel, we took samples of your stomach. We then did the colonoscopy, then we did a whole series of blood tests for you. There's no evidence of significant vitamin or mineral deficiencies that could be contributing to your recurrent mouth ulcers. We've also outruled celiac disease, colitis, and also Crohn's disease. So it's very reassuring that we know you don't have celiac disease or inflammatory bowel disease. It does leave us in the conundrum that we don't know why you have the mouth ulcers, and we may never find an actual cause for them.
Being not diagnosed with celiac or Crohn's disease, it's a huge load off my mind now at this stage. Celiac was in my family, so I kind of ruled that out. So once I tested clear for that, I was happy enough for that.
Since Stephen's results, he's had some good days and some bad. Pixie checks in to see how he's getting on.
It's probably been about 2 months now, I'd say.
In that 2 months, is this the first outbreak of ulcers you've had? Or?
Oh, no. I'd say the ulcers went away about 3 or 4 weeks ago, for maybe 3 weeks, and then they're back. Within the last couple of days, really, they came back real bad.
So if I'd spoken to you last week, you probably would have been delighted.
I was very delighted, yeah, and then a few days later, I wasn't so delighted.
Frustrating though that they've come back, isn't it?
It is very frustrating, yeah. I thought I was on a road to, a clear mouth again, but they're back twice as bad now, again,
In a lot of cases, we don't know the answer for ulcers. What's very important is because it was such a dramatic thing that happened out of the blue for you and has been, going on for such a long time. We wanted to make sure that it wasn't due to any underlying bowel pathology, any underlying bowel problem. So that's very important to know that all is well there in terms of inflammatory bowel disease or celiac disease.
I'm looking into going to see a dentist now at the dental clinic in Dublin. So they're going to look into it a bit more, maybe take a biopsy of one of them.
I know it's frustrating not to get an obvious answer when you have a test, but to get a bit of reassurance goes a long way as well. Keep saving all those lives and keeping us safe on the sea.
Yeah, I'll try my best.
And again.
Don't bother, thanks very much for the call.
Okay, Stephen.
Cheers, thank you.
Bye.
Stephen will continue to try and find a cause for his ulcers. He can take solace from having ruled out celiac disease and Crohn's, but he has no intention of going back on the cigarettes.